So my son had spinal surgery in Temple Street in 2018. He was 18 years old. He should have had that surgery when he was maybe 12, but he didn't because it's Ireland. And he was on an extremely long waiting list. And his curvature was so pronounced that it compressed his organs and compromised his lung function so that he had something like 20% lung function. I don't know what your higher specialist training is, or yours. I don't know what your memberships or your fellowships are, or what your discipline areas are. But as a layperson, I know that's wrong. That shouldn't happen. It's foreseeable. It's preventable. It's reportable. Before surgery, he had to have a cardiac review. The cardiologist on the scan discovered that his heart was in a part of his chest cavity where it shouldn't be. And it was a teaching point, and she called her team over to have a look at it. And Owen saw it on the screen, and he vomited into the sink at the sheer shock of it. And he said, and I quote, "It's all right for you, it's not your heart." The anaesthetist told us that he was an anaesthetic risk and that he might be inoperable, as is the case for some of the other parents here. We went into surgery. The surgical teams were brilliant. The surgeons, the likes of Damien McCormick and Dr. Green. This question, and you know, I was in the hospital in Temple Street when you were CEO. I slept in my car outside on the street. Now, eventually I did get a room after a number of days. I brought my son in. He was frightened. He was wearing his mother's bracelet. And when they gave him the initial little numbing rub to put the PICC line in or whatever it is, I was ushered out and I was handed his bracelet and left in the stairwell. That surgery was complex because of the delay. So you come from Great Ormond Street, according to your LinkedIn profile, and you see a cohort of patients and a way of treating people that is completely and utterly out of step with what happens in the rest of Europe in terms of delay, chronic delay. So, did you report it to the international literature? Did you blow the whistle? Did you invite research teams to come in and look at this extraordinary hospital where all these extremely complex surgeries take place because of delayed treatment? And if not, why not? And can you stand over this sort of system that we have with all of these suboptimal outcomes? One patient brought back 33 on 33 separate occasions. At what point did you not think, or did you ever think that that was a completely, I mean, the springs are a symptom only of a completely dysfunctional system that you have presided over as CEO since 2018, and you come in here with two clinicians who blew the whistle. The Boston group and the other review, were they patient-centred? Did they involve the families? Like, you know, I think we're not seeing the wood for the trees here. This is an absolute, like everything we're talking about here and all of these investigations that you use as a rhetorical device to not answer questions. And this is something that the HSE have employed over the last, under Paul Reid's stewardship, under his predecessor's stewardship. I don't know what Bernard Gloucester's going to be like. Oh, we can't comment on individual cases, or there's an investigation underway. These are all rhetorical devices to evade the blindingly obvious that what was happening in Temple Street, and I only know from my own experience, I know that what happened was unusual. I'm very grateful to the surgeons who intervened. But you must know, as medical professions and somebody who's been CEO of the hospital and prior to that was CEO of Tala. If you had a cardiac unit in Tala Hospital that was performing suboptimally to that extent, like the airline industry, would you not blow the whistle, call for help? If it was an oncology department that was performing in that way, would you not call for help? If it was, a labour, a maternity hospital that was that was performing in such a strange way, would it not? But you didn't. And the reason why you didn't is because our children are disabled children and don't have the value in Irish society of other human beings. And I'm just surprised that you came here from another jurisdiction and felt that that was, I don't know what you felt, because I just don't know. So, I mean, I'd like to invite you in the time that's remaining to tell me, how was your behaviour consistent with you remaining as CEO of CHI, or remaining as, is it CMO?
Correct.
I mean, I'm a layperson and I know this instinctively. Modern medicine is led by research, is informed by research for best practices. What you were presiding over was a recurring, foreseeable, predictable pattern of suboptimal outcomes, suboptimal leaving children on waiting lists for so long. What did you do about it? Damien McCormick and the other fella came in here and blew the whistle. When did you blow the whistle? And if not, why not? And if you didn't, is your position tenable? Is it credible? And finally, that Boston, do you still maintain that Boston group was an independent group that was family-centred, an independent investigation? Or were they accompanied at all times by senior people from CHI?
I'll have to let there's been a number of questions there.
I'll take some of the questions. I think... Sorry. First of all, I'm genuinely sorry that your son and you had to wait that long. That's unacceptable. So, and that's not what we're striving.
But it still happened, isn't it?
Yeah.
For hundreds of other families. So sorry doesn't really cut the mustard. If it's still, you know what happened to me, great, but you know what's happening to hundreds of other families. Have you written a paper on that?
Tom.
Have you reported that to your professional organisation? Have you sounded the alarm? Have you raised a concern about it? Have you? Yes or no?
You
haven't.
Can we let the witnesses respond? You've asked a number of questions.
Well, it's a simple yes or no. Have you raised a concern with your professional association or the international medical community about what's happening in Temple Street in Ireland? Have you?
Senator Clonan, can you allow the witnesses to respond to some of your questions?
Well, I mean, you keep interrupting. Will you answer
the
question?
I'm not. I haven't interrupted you at all. You know, you have 10 minutes there. You know, I haven't interrupted you. So, please, witnesses, if you want to respond.
I think the system and the restrictions we have at the moment is what we have. We are doing our very, very best to make the system as better. Last year we did, 162 more children were treated than before, and we're working within the confines of Temple Street Hospital with 9 ICU beds and 100 beds. That's plus.
Have you raised a concern?
Sorry, just to finish. Plus, this is it's the same with Crumlin. Both hospitals are operating at absolute maximum capacity. The new hospital holds potential and hope that we can really move in a different directions. But right now we need to do whatever we can, and we truly are trying to make things as best we can to try and treat as many children as we can. We have 39 specialties, and we can only work within the confines that we have.
And what you see here is consistent with what happens in Great Ormond Street or in any other jurisdiction in the EU.
Hey, Tom,
we're outliers.
Tom,
have you raised a concern?
Yes,
no.
Senator
Clonan,
I can help answer that.
Do you want to answer?
And again, I'm sorry that your son had to wait so long for the treatment. Yes, as an organisation, we have identified as two of our principal risks for our organisation. One of them relates to patient safety, and the second one relates to access to care. We are putting into our reports, and we escalate to the system, that we have challenges with delivering what we want to deliver in Children's Health Ireland. We know the standards. People come back to us internationally, want to work with, and we are limited. We're constrained with some of our physical infrastructure, and I'm not making excuses here, but we are going to move out of these facilities in the next year and a half. We have 12 theatres, and we're going to have a 13th. We have 22 in the Children's Hospital. There's some real, genuine constraints. So as an organisation and as somebody who values children and their families, we actually have identified, and we escalate through the process that we have, that patient safety around, and it is compromising, and we're sorry about that, and there are others around
Thank
access
you.
to
Who
care.
did you escalate it to? Who did you raise those
So
concerns with?
we have a process with our board that we actually through which we do this. We then have a monthly meeting with the HSE around performance, and we escalate it there, and then we produce an annual report where we escalate
So you've
it there.
escalated to the HSE, so it's internal.
Well, I think that's our reporting line for elements like that, and and if I may, the Boston report of review, we didn't sell it as an independent review. I think that's important too. That it was external to us to actually come in and look at clinical elements, and we were concerned around the clinical elements, and that's what that focus. That's what the HSE is doing is an independent. It's a different type of review. I just want that clarification.
I have to move on to two other members then. Come on.
I'm sorry, the Boston bit I would like to just, so that it's not left as it is. It wasn't just a 3-day visit, I just wanted to make that. The Boston team were involved for at least a month, if not 6 weeks before, where they were reviewing the charts, the notes, and having virtual conversations with a lot of staff. So it wasn't just a 3-day visit, it was much longer. And I think I truly do have respect for the organisation, their integrity, and that they would do an independent review, not influenced.
Okay.
You
sorry.
knew
sorry.
that Temple Street
Sorry,
was out of step
Senator
with
Clonan.
international practice.
Senator Clonan, I'm moving on.